you and your health with Dr. Richard Okoye.
Hi, what an honor, a privilege for us to talk together on a very, very important issue that has to do with you as a lady and also you as a guy, when it has to do with knowing the ovulation time of your wife or even yourself. Because you see, I used to think that the issue of abortion, which most people say unwanted pregnancy or unplanned pregnancy, and I thought it's something of a problem of only the singles. But I was amazed in the course of practice that many married women will use abortion as even as a means of family planning, which is a horror, a demonstration of ignorance to the extreme indeed. And by reason of this very passion, I want to show you something in the reproductive program of a woman, which of course I could say that God has provided for you to know when that word they used to say, my safe and my unsafe period. At what point will my ovulation come? At what point will I get pregnant? I do hope it will be of a delight for you to know. Let me take this. Every woman has menstrual cycle. But something that is not very clear to most women is that they fail to realize that you have a range of menstrual cycle which differ from one woman to another. So you can't use the ovulation time of another lady to calculate your own. No, you will get it wrong. You will get pregnant at the wrong time, or you may not get pregnant as you are hoping to get. You get that one? Now, look at this. In this very menstrual cycle, it has been studied and found out there is a normal menstrual cycle that ranges from 21 days to 35 days. I get it again, 21 days to 35 days. That implies if your menstrual cycle, what they call menstrual cycle, at the point you saw your menses today, the next time you saw it again, a time between that and the next one, you calculate it. It could be 21 days, some persons 28, some persons 30, or to the range of 35 days. Averagely, most women do see their menses 28 days. But that does not mean that a person whose own is lower than that 28, up to 21, and somebody whose own gets up to 35 is also not a normal woman. Perfect and good. That range, okay. Now, what does this hold when it has to do with ovulation period? Ovulation period is the time of a woman to have the capacity to get pregnant if she has intercourse on that particular season. Sometimes you call it ovulation period because of the range around that particular axis, which can give the woman opportunity to get pregnant by God's design. Now, it can hear some women. They will say that I'm not safe. I don't know whether it's from Boko Haram or whether from militants or their safety. You begin to wonder, what is it? Is it that they are not safe of what? And you hear say, this is my safe period, this is my unsafe period. He's just trying to say that this is a period I may not be able to get pregnant, and this is a period I'm likely to get pregnant, and that is the time of ovulation. How do you then calculate it? Seeing the varieties, seeing that the time varies from one woman to another. So many women have been in the confusion. They don't know who will give them the right direction. But I'm here out of passion to show you how you can do that, to make you live a more healthy life, preserve your womb, because so many women had already gotten their womb damaged by reason of unnecessary attempt on abortion and all the complications associated with it. Okay, look, first of all, you need to know your menstrual cycle. How many days is it? If you have not done that, start now to do it. Monitor your next 3 months. I will open up my line even to chat along this very line to guide you. Now, if you start it off from today, if your menses come today, you record it day 1. And when it comes again, you record it. You calculate from that day 1 to the next time you saw it. You know that is a cycle. And you calculate. Now, there's a little mathematics. Apart from other science I will show you. the little mathematics on how to know the day of your ovulation. Now, you'll be in position to look at it this way. When you know your menstrual cycle by this reason, by this calculation, now your own ovulation period will be with this mathematics. Take in your mind 1, 4, 14. It's a constant mathematical factor we're going to use right now for you to know yours, which is different from the next person. Now, if you know your own menstrual cycle, you just have to say that's a menstrual cycle minus 14. Whatever you get is your own day of ovulation. Now, let's calculate it this way. If you have a 28-day cycle, you know that it's 28 days. Now you can now say 28 minus 14. What is it? 14, isn't it? That is to say you will ovulate if you start from day 1 to count 1, 2, 3, 4 on to 14. You are likely to ovulate that particular day. That is your ovulation day on the 14th day. Now, what about a woman whose cycle is 30 days? We still have the same factor. 30 days minus 14, that should be 16 days. So, counting from day 1 up to the 16th day, that woman is likely to ovulate. Alright. Also, what about a woman that her own is just 21 days? Very short cycle, isn't it? Now, is the same formula also applied? 21 minus 14. That is 7. This lady is likely to ovulate very close to the period of her menses, after her menses. If she bleeds for 3 days or for 4 days, the next 3 days she may begin to have ovulation. But what if she doesn't have a knowledge of that? Soon after ovulation, she can get pregnant. But if she then begin to follow those people whose one is 14, who knows is 28 days, and now get to 14 days and hoping to get pregnant, her ovulation must have passed. So, same thing applicable. If it is 26 days, yours. You know what you do? 26 minus 14, that gives you 12. So, your ovulation is on the 12th day. That is to say, whatever you have, minus 14, get it, count from the beginning, that day you will ovulate. I think it's interesting. Okay. For those that have not been able to know their ovulation time, it is important for you to, first of all, the next 3 months, begin to check the time that you see your period. When it stops, you mark it, see the next one, you mark it, see the next one, you mark it. Then you can sum it to say, my normal menstrual cycle is this or that or that. If you have question, you can get in touch either by WhatsApp or whichever means, and we could be able to guide you, to give you maximum protection. God made you a woman to have a protection from the so-called unplanned pregnancy, for you not to be a victim of abortion and the complications of the same. And that also, for Doctors Save a Life Foundation, is available to offer you. Now, some people may have irregular menses as a result of maybe polycystic ovarian problem, or maybe as a result of hormonal or other reproductive factors. That also can be defined by reason of you having a contact with your doctor, and he can be able to help you correct such an anomaly. Okay? So you can have something that is more regular as other women. Now, there are other signs apart from the issue of you can making this calculation. There are other changes in a woman's body that should tell whether this woman can get pregnant or whether she's seeing ovulation or not. And that has to do with the issue of cervical mucus. Cervical mucus. Now, let me tell you, if you put your hand inside the vagina, you will need a structure that, like a tip of the nose. It is called the cervix. There's usually something like a that usually cover that place, so that the sperm or whatever infection may not go inside. Okay? Before ovulation, those catarrh-like things called the mucoid plug, they used to be thick. So it is very difficult for anything, including the sperm, to go in there. Now, towards ovulation, you will see that particular catarrh-like thing will turn like something like okra. You know, when you put okra, it will just be very smooth, very light. At that particular point in time, it's a sign that you are now ovulating. Okay, you can have a look at it. This is that cervical mucoid before, when there was no possibility of ovulation. You can see, and you can see how free this other one is. That is the different stages and what you can get during ovulation. But that very sign, if some women may or may not, that at that point you may look at all these other calculations we also made to. Some also others can have a kind of changes in their body temperature. That time they will become a little warm. Some people will say my breast is heavy and all that and all that. Individual variations could be there. So if you don't have such a, don't begin to say no, I'm not ovulating at all. However, in a worst case scenario, you say you are confused, I don't know how to go about it, then you have to consult, you have to consult your doctor so that he will be able to guide you nicely, and that will help you and help you, because wisdom is profitable to give direction. If you lack it, you will be a victim of life, and that is why this very message is very essential. Learn it, share it with other people, and take advantage of it. Nevertheless, God did not provide it for abuse. It's made it for you to live a more healthy life. God bless you as we share this.
You and Your Health with Dr. Richard Okoye.